Are you a parent who has concerns about your child's teeth? Perhaps you've noticed crowding, rotations, or malalignment. Maybe you've even looked at their smile and wondered how in the world all those permanent teeth are going to fit inside that tiny mouth. If so, I'm glad you're watching this video. My name is Dr. Ariana Ebrahimian, and I am a dentist who helps children have not only beautiful smiles, but beautiful healthy faces as well. You may not know this, but problems such as a deep bite, an underbite, or a gummy smile can actually be indicative of long-term health problems. Using a unique approach to orthodontics called Biobloc Orthotropics, I help guide children's growth in the direction Mother Nature intended, maximizing both facial aesthetics and overall health. What pains me most is seeing older patients who have orthodontic problems that started small early in life, but were left untreated or undiagnosed and became much more complicated later on. Problems that are not just cosmetic concerns, they're health concerns. That's why I created this short video to share with you why teeth go crooked, how this can affect facial balance and overall health, and how I use Biobloc Orthotropics to correct these problems. Contrary to what you may think, teeth do not go crooked just because of genetics. It's not because your child has daddy's teeth in mommy's jaws. It has more to do with function, or a concept we call rest oral posture. Simply defined, rest oral posture is how you hold your mouth while at rest, or for example, what you're doing with your lips, teeth, and tongue while you're watching this video. Really excellent rest oral posture means that your lips are together, your teeth are lightly touching or slightly apart, and your tongue is all the way at the roof of the mouth with the tip of the tongue right behind the upper front teeth. This creates a situation whereby the pressure of the tongue pushing out on the teeth and the pressure of the lips and the cheeks pushing in on the teeth are in balance. The teeth line up in a beautiful arch, and there is rarely a need for orthodontic correction. Problems arise, however, when there is a change in the oral posture. Mouth breathing, thumb sucking, and splinting the tongue behind the back teeth are all examples of improper oral posture. This can lead to problems such as crowding, a deep bite, or an open bite. But it doesn't just affect the teeth. Improper oral posture affects the whole face. Take a look at these photos. On the left-hand side, you see a picture of a boy at age 10. You'll notice his lips are together, he has a strong jawline, and an overall attractive face. Now look at the two pictures on the right, taken 7 years later at age 17. What a dramatic difference! This young man has his lips apart, flat cheeks, a very weak jawline, and an apparent hook in the nose. It almost doesn't look like the same boy. So what happened to change his face so dramatically? Well, around the age of 10, this boy acquired a pet gerbil which was kept in his bedroom. He was allergic to the animal, and as a result of his chronic stuffy nose, he had to start breathing through his mouth. This chronic mouth breathing literally changed the direction his face was supposed to grow, from a down and forward direction to a down and back direction. Now, I think we would all agree that the 10-year-old boy is better looking than the 17-year-old. In fact, using a profile norm diagnostic, we can actually see where his face ought to be. So it is clear that oral posture can have a dramatic effect on facial balance. But what about his overall health? What does his face tell us about that? In order to understand how I believe your profile can affect your overall health, it's important to understand some basic head and neck anatomy. Your tongue is a very large muscle that extends much further down your throat than you can actually see. It is attached to your chin, and behind your tongue is your airway. When you breathe in through your nose, air passes behind your tongue, through the airway, and into your lungs. If, however, your jaws are positioned too far back in the face, like the young man you saw, the tongue gets moved backward as well. This becomes most critical during sleep when you're usually lying on your back and all of your muscles relax. If your tongue relaxes and obstructs the airway, you can end up with obstructive sleep apnea, a deadly disease that can dramatically increase your risk for heart attack and stroke and literally shorten your lifespan by up to 20%. Having an unbalanced facial profile is not just an aesthetic concern, it's a health concern. The good news is there's a solution to this problem of poor oral posture and improper facial growth. It's called Biobloc Orthotropics. Developed over 50 years ago by Dr. Mew, Biobloc Orthotropics uses a series of removable appliances to ideally position the jaws in the face, reverse any unwanted facial growth that has already happened, and correct the oral posture that caused these problems. What I love about Biobloc Orthotropics is we're not just treating the symptom of crooked teeth. We're treating the cause, poor oral posture. We're retraining the lips and the tongue to function properly, and in the process, we're setting up a child for long-term health and stability. There is no other treatment short of jaw surgery that has the kind of facial profile results that you can achieve with Biobloc Orthotropics. In fact, it's even been dubbed surgery without a scalpel. But it's not just an improvement in the facial balance, it's an increase in the size of the airway as well. Studies have shown a 31% increase in the nasopharynx, a 23% increase in the oropharynx, and a 9% increase in the laryngopharynx. A larger airway may be the difference between somebody who suffers from sleep apnea and all the health problems that go along with that, and someone who does not. A solution for both health and beauty? Now that's something to get excited about.
My problem was my jaw was too far back and my teeth were crowded. We did Biobloc Orthotropics to fix the problem. I had my Biobloc for about a year, and although it was challenging, the result was worth it because I loved my profile. And now I get a lot of compliments on my teeth because of Dr. Max and Dr. Ariana Ebrahimian.
If you think your child could benefit from Biobloc Orthotropics, call us today at 831-438-4411 to schedule your consultation, or visit us on the web at www.functionalsmiles.com.